Switch on.
Hello everybody and welcome to today's webinar. Chris and I are hosting today. We'll introduce ourselves properly in a moment, but basically what we've done is we've pre-recorded a video for you because we've got some people talking about their lived experiences. The video lasts about 42 minutes and then what we'll do is we'll come back together and answer any questions that you've got, any discussion points you want to make, and if you can make those via chat, that would be great. What we'll do when we go into the video is we will spotlight you so you've got a nice clear view of the video, and we hope you enjoy that, get a lot from it, and we look forward to any questions at the end.
Yeah, see you soon.
Bye for now. Welcome to our webinar today on COVID-19, a psychological understanding of staff experiences and resilience building. Just going to start off with some introductions.
Oh, hi, I'm Chris McLean. So my background is nursing, midwifery and primary care nursing. So I was a practice nurse here in Leeds for 10 years. I've been running my own business for the past 10 years. And my business is focused mainly on resilience, leadership and change management and communication. And yourself?
So my name is Dr. Alison Oldham. I'm a clinical psychologist, spent 12 years in the NHS working as with children and adolescents. I then went into higher education where I was Director of Student Services at a couple of different universities, and then more recently I've been self-employed. I work as a consultant, a trainer. I've got also got a small private practice, and Chris and I work together for a company called Et al. Training, which is provides a number of different training courses, but at the moment one of the ones that we are providing is 2 half-day webinars on, two half-day interactive sessions on COVID-19 and helping NHS staff understand some of the experiences that have been ongoing over the last year. So that's us. Yeah. Should we make a start? So let's just start with an outline of the webinar today. So what happened was we've got 2 videos to show you, and we interviewed a couple of other people. And basically what we did was we asked each of them the following questions. How had COVID affected their working life practically and in relation to the content of the work that they did? How had COVID affected them in terms of their emotional state, their thoughts, their well-being? What, if anything, they'd found had helped them cope? And what, if anything, had been positives throughout the period? And in terms of the structure of the sessions, what will happen is we'll hear from each of our volunteers about their experiences. We'll have a think about understanding their experiences from a psychological perspective, and we'll think about what they found helpful so that we can explore what we can learn from them. So
how do people respond to stress, pressure, risk and adversity? What impacts on how a person responds and bounces back from difficulty? Because there's little doubt that one situation can provoke very different reactions in people.
Sure, okay. And what do we know from a research perspective? Well, in June, July 2020, researchers at King's College asked 709 workers anonymously how they were coping after that first wave of COVID. And what they found was that nursing staff were more likely to report distress than other clinical staff. And nearly half reported symptoms of severe anxiety, post-traumatic stress, depression, problem drinking. So very significant numbers struggling. But they also found that over half reported good well-being. So I think it's also interesting to think about, well, what makes the difference, and how can we positively look after our well-being in very difficult times?
Yes, absolutely.
So let's start off with our first person, and that's Sally, who's an operations director. So let's hear how Sally responded to those 4 questions.
My name's Sally Curtin, and I'm an operations director in a business that manages local authority leisure centres on behalf of local councils. We have over 45 centres across the UK. My role involves the day-to-day management of the subject matter experts, and these are individuals that support the centres and the staff to deliver a service to the public. So question 1, How has COVID affected my working life practically and in relation to the content of the work that I do? So at the start of the pandemic, I took on the responsibility of being the operational lead and expert on COVID to ensure that the business was kept up to date on all of the new guidelines, regulations and impact. As a consequence of this, I started to work from home permanently from around the beginning of March 2020. Before that, I would have worked from home for maybe one day every couple of weeks. The reduction of travel time has been one major change. This has meant more time to work, but I did used to like the time in the car to plan my day ahead, decompress on the way home. It was also a time where I could call colleagues to catch up, have a chat, listen to audiobooks, or just reflect on my day. Question 2. How has COVID affected you in terms of your emotions, thoughts and well-being? So at the start of the pandemic, I used the time really well to focus on my newly acquired role, to keep the business informed and to generally crisis manage on a day-to-day basis. It was relentless and the pace of work was like nothing we'd experienced before. Many colleagues were put on furlough, and as a consequence of that, there was obviously more work to do with less people. The good weather meant that I could keep up with my exercise early in the morning when it was light, and this hugely helped my mental health in general, but also my ability to sleep. However, as the situation has continued and we've moved into the winter months, it's been very difficult to continue to self-motivate to do exercise and to get out for fresh air during the day. I'd say I've probably not slept well for about 6 months, and there doesn't seem to be any specific reason for this, just a general level of uncertainty, I think. There definitely are good days and bad days, and again, no specific reason for either. Not having things in the diary on weekends and nothing specific to look forward to is tough. We've planned a number of things for months ahead and they've all been cancelled at different stages in the last year. It'll be really good to be able to book with certainty and to really have something to look forward to. Next question. What, if anything, do you do or have you done that you have found has helped cope during this time? There have been weeks when I wouldn't leave the house, literally from a Sunday through to a Friday, just because of volume of work. I now try really hard to ensure that I get out a couple of times a week during the daylight as a minimum for a walk, even borrowing my friend's dog on occasion to make sure I do this. The sheer volume of work in lockdown has made it incredibly difficult to book any focus or thinking time in the diary. I now look at my diary a couple of weeks in advance and purposefully put in specific hours, daytime walks, thinking or focus time, and also for cup of tea chats with colleagues. So a chance to catch up without there being a really specific agenda or formal reason to have a call. I've also told my team and my peers that I will be joining some meetings via mobile and not on the laptop. Just so that it makes me, I have permission to get out and go for that walk. If there have been any positives during this time, what have they been? So a few examples would be really practical for me, which is things like spending time at the allotment, doing jobs around the house or in the garden, but also exploring the local area, finding new places to go for walks or going out on the bike have also been really good.
Okay, so that was Sally. What did we hear from her? So one of the things that came through from Sally was the struggle to keep motivated, starting off really motivated. And obviously, we're nearly a year in now and it's very difficult to keep that up over that period of time. Struggle sleeping, and that's been an ongoing long-term thing. We heard from Sally, didn't we, that and really that felt as though it related to a bit of anxiety and uncertainty about what's going to happen. Good days and bads, and accepting that there's going to be ups and downs, really. One of the messages that came through strongly, and I'm sure other people will recognise this, is the impact on the amount of work. So for Sally, it was about a lot of staff being furloughed, and that meaning that there was less staff to do, share the burden of the work, I suppose. For other people, it may well be people are off with COVID and COVID-related illnesses, and therefore there's less staff to do the same amount of work. But really that impact on workload and having to work hard. And the other thing that I thought was really significant about what Sally said, and she just broached it, the way that she phrased it was lovely, the decompression, and the importance of that journey to work and the journey back from work. And I thought it was really interesting that she really identified that that journey to work was important for her planning of the day, for psychologically preparing for the day, and that the journey back was about psychologically settling from the day and putting the work day away. And what the loss of that journey has meant for her. I thought that was particularly powerful. And it reminded me of before COVID, what we used to say sometimes, one of the phrases that people would say is, I'm really struggling to leave work at work. I'm taking work home with me all the time. And now, of course, we're physically doing that because so many of us are working from home, that there isn't that separation, that delineation. And I think psychologically that is really important. And of course, not having those nice things to look forward to, I think, is a challenge as well. What did you hear from Sally in terms of how she's managing? There was a real development, I thought.
Yes, yeah, really interesting. So I think when she was talking about setting goals, small goals, smart, achievable goals, even if it's just in the middle of the day, just taking yourself out for a walk in the daylight. I think walking out in the daylight was really interesting. I loved the way she talked about not joining meetings from her laptop. She set expectations with her team that she was going to be out and about, and that's role modeling as well. So she's going to be out and about, she's going to be walking, but she will still interact with the team, which I thought was amazing.
Great idea.
Yeah, it really is. She talked a little bit as well about commitment, even committing to a friend's dog. So it's I think that's about routine in your day as well, keeping to some kind of routine. I love the idea of cup of tea meetings. Just rather than talking about work, rather than that being the focus, it's that thing, isn't it, about proactively asking, how are you? Because I think sometimes unless you're asked, you might not be forthcoming in saying how you are. So I think, and that focus, having a bit of focus, thinking about how can I plan my day. We know that days often don't go to plan, but it's nice to be able to plan it and then maybe take a few things off at the end. Psychologically, it feels like you've achieved.
So the planning the day and having space, planning space in the day, so you've got thinking time as well. One of the things that I really liked about that as well was that Sally's obviously learning as she goes. She's learning how to do it and how to do it differently, which of course we all are, because it's so new to us. But you can really see how she's changing things all the time in order to look after herself in the best way possible. So let's move on to Andy. Andy is Deputy Head of Nursing, Respiratory Nursing, and I know you spoke to Andy, so tell me a bit about Andy.
So Andy's a very senior nurse, of course, and worked a lot in intensive care as well. When I talked to him, he said that this sustained threat had really had a lot of impact on him psychologically. So somebody that hasn't necessarily been to the doctors with physical symptoms previously, go to his GP, he started to have heart palpitations, he's had some intrusive thoughts and flashbacks, the images that he's seen. He also recognised that he was consuming the news too much, really, in a way. And he talked about him and his team being battle weary, saying that, if it was a conflict situation, the same soldiers wouldn't be going back in, but they are, and they just wonder how long they can keep going with this sustained threat, because it's often more challenging. So that's what Andy was saying, really.
What a powerful analogy that is with war. That quote from one of his team members was just so powerful, wasn't it? you know, about going back into the front line again and again and again without a break. And
absolutely. And
the
it's
real impact
interesting.
that's having.
Absolutely. It was interesting as well. He said, you know, the clap for carers at the beginning. He quite liked that. I mean, it can take you one of two ways, and some people didn't like it, but he just feels now that that support, it feels like it's gone from the public, and that's just an added thing for him, really.
So him and his team keep putting themselves back out there despite the fact they're battle weary, but feel as though it's not been acknowledged or appreciated in the same way. And just really picking up on the powerful impact psychologically that this has had on him. So this is somebody who hasn't really struggled with anxiety in the past, but who's got real, very significant physical symptoms of anxiety, the palpitations you talked about, again, sleeplessness, it was something that he mentioned, some of that intrusive thinking and rumination. That just, you know, it's taking its toll on him psychologically, isn't it? And I think there's something about the sustained threat that you talked about, that's having a real impact psychologically, but also the ways that our bodies physically respond to threat. Keeping that physical response up over a very long period of time is very demanding on the body and has an impact on the body as well, I think. Okay. And I just wanted to say here really that I think symptoms of anxiety are not at all uncommon in this. So one of the things that we just wanted to do was put up the symptoms of anxiety for people to have a look at, in case you recognise some of these things in yourself or in your colleagues and others. And all we've done is just taken this from one of the NHS sites. And in the next slide, we just, again, linked you in, signposted you into some of the NHS sources of self-help and coping with anxiety. Because really that recognising it in yourself and seeking out support, whether that's self-help, whether it's talking to somebody, is a real positive sign for people. So
it's a key strength.
It is
a key strength.
Yeah, absolutely. So what did you hear in terms of what we can learn from Andy?
So Andy said some of the things that he's been doing to keep himself okay was to really limit the amount of news that he consumes. As a family, they don't watch very much news at all now, because I think it just compounded psychologically that feeling of what's going to happen next. He does use mindful apps, so they're very, very helpful. And talking to friends and family, you know, having that social network, having that group of people that you can talk to is really important. One of the really lovely things he said was that he felt really lucky to be able to still go to work. Because he still got his colleagues and his team around him. He just felt lucky that he wasn't having to stay at home like his wife stays at home working and doing homeschooling. You know, so he feels really lucky that he can be there with a group of people to share experience.
The importance of connecting.
Absolutely.
The other thing, just hearing you talk about that it made me think about was particularly the news, that one of the things that when we're looking at the news, watching the news, we can't control what it's going to show or what's coming in. There's no way of us filtering that. And I think there's something about repeatedly watching the news that sets up an expectation in us that if we're watching it all the time, we're waiting for something to happen. And the speed of change and things. And of course, in the early days, things were happening quite quickly. But of late, things are happening very slowly. And I think repeatedly watching it sets up an expectation of change that just isn't there often.
Absolutely. So he's found that really useful.
So a real tip from Andy there. Potentially. Okay. So let's move on to Hilary now. Hilary's a lung cancer specialist nurse, and let's see what she had to say.
My name's Hilary. I'm a lung cancer specialist nurse at the Christie Hospital. First question, how has COVID affected your working life practically and in relation to the content of the work that you do? Well, I'm very fortunate to still be able to go into work. However, the work that we do has changed dramatically. We would have, prior to COVID, full clinics with patients and relatives in waiting areas. Now we've got very few patients actually attending the hospital unless we physically need to see them. However, when they do come, they're unable to bring their family members, so they haven't got the support with them. We've got PPE on when we see them. We've got masks, visors, gloves, aprons, and that creates a barrier between us. So it's very difficult to communicate when you can't see expressions, you can't see people's mouths. And it's difficult as well for patients who have breathing difficulties to be wearing a mask throughout a consultation in a small room. We've also changed the way we work from less face-to-face now to telephone consultations. So what tends to happen is the doctors ring new patients, have conversations over the phone, talking through diagnosis, treatment options and prognosis. And then we follow up as specialist nurses a couple of days later to go through that information with them again and obviously answer any questions that they have. So those conversations tend to be quite intense. They don't generally ask questions of the doctor, so they tend to pick that up with us. So we've got lots of questions to answer and they tend to be quite long and in-depth. They're complex, they're emotional conversations, and obviously we're unable to see their reactions as well, so it is more difficult than seeing them face to face. And finally what's changed is that we're working from home. So a lot of we have 6 people in our team in a very small office, and so we've reduced the number of people who are in that office at any one time, which means we have to work from home, and that is different and quite isolating at times. Question 2, how has COVID affected you in terms of your emotions, thoughts and well-being? Well, as I said, I'm fortunate enough to be able to still have routine and be going to work, but because of the changes, because we're doing so much more on the telephone, it is very intense, and we're having emotional conversations about death and dying. We don't tend to get a break as we would in clinics. We're going from one phone call to the next. And when we're working from home, we don't have the support of our colleagues around us just to be able to chat about calls that we've had. So that can be quite difficult. Also, when we are in clinic and we're seeing patients face to face, we're taking on the role of the family for the patient and supporting them where they would normally have somebody with them. Question 3, what if anything do you do or have you done that you've found that's helpful to cope during this time? Main thing for me is exercise, is fresh air, is getting out, getting a break and getting away from work. Keeping in touch with family and friends is also really, really important, and they help keep perspective on life. Also, we've got a really supportive team, and we do chat, we do have regular sort of video calls so that we can discuss things that are difficult, and we support each other as we're going through this difficult time. And finally, if there have been any positives during this time, what have they been? I would say there's been lots of positives. I know it's been incredibly tough, very tough for a lot of people, and it's been quite relentless at times, particularly with the new ways of working. But I think what we've shown is that we've been able to adapt. We've been able to work with the new ways of working, using the phone, being the support for the patient when the relatives aren't there. We've also been able to develop our communication skills on the phone, which is very different to communicating face to face. And we've shown resilience, that we can continue to support our patients throughout this pandemic. We've also shown that we've got a supportive and effective team that's allowed us to work well together whilst being remote.
Aren't people incredible?
Aren't they just? Aren't they just?
Right, Hilary. So what did we hear from Hilary? I thought that point that she made about taking on the role of healthcare and being a family member and friend as well was particularly poignant. And what an emotional challenge that must be, and an emotional burden to be able to try and do both things at the same time. So a really significant change in the role there, I think. The challenges of telephone working, Hilary talked about, but also talked about overcoming them and managing them and learning them. And again, that development piece was there, I think, which was really significant. But of course, telephone working is particularly difficult, especially when you're having such challenging conversations. And it's about the nuances, isn't it? You can't see a person's non-verbals. It's more difficult to interpret the silence. It's those nuances of telephone working that make it harder. But it sounds like, you know, she's learning ways around that, listening particularly for tone, for the detail, checking out, etc. The challenges of PPE, again, I thought she described that really well, just that barrier between the healthcare worker and the patient, and being able to understand their responses and their emotions because of that barrier, and how difficult that is. What I really liked, though, was a real pride from Hilary in what she's achieved and what her team have achieved, and the fact that, you know, they're still providing a high quality service and care for patients despite the significant difficulties around them.
Yeah. So what can we learn from Hilary? Well, for me, the importance of exercise came through. And as we know, research shows that for mild to moderate depression, exercise is just as good as medication. So making space in your day to do that, like Hilary's doing, is really important. What came through as well, the importance again of connecting with people, your team members, your community, the importance of friends and family.
She said the same as Andy as well,
she
didn't
did.
she? I still get to go into work.
I know, which is amazing, isn't it? It's amazing. In fact, at Ward in 2020, she did a random controlled trial study of all the research that was available around what the positive factors that reduced psychological distress or created psychological distress. And what she found was there were 3 key things that reduced the chances of psychological distress. And those were team cohesion, support, and organisational support. Those were the 3 key tenets of helping people to make a real difference. The thing is, Ali, I think you can make a huge difference to your colleagues just by asking, how are you? Proactively asking, how are you doing? And making time for connection.
And I think one of the things that we've learned through this process is that if you don't ask, people won't always volunteer it.
That's right.
So quite often there's people struggling who you don't know they're struggling. And so that asking, that active asking is really important. And I think there's, you know, potentially something around it being particularly important in healthcare as well. We know healthcare workers, generally speaking, are incredibly resilient, despite everything that's going on. But there's almost, the can't for carers, but, you know, there's also almost a bit of superhero, NHS superhero piece. And sometimes what can come along with that is that it's not okay not to be okay. And I think we need to, as best we can, create a culture where it's seen as a positive to ask for help if you need it, and to tell people that you're not all right.
Absolutely. Being able to ask for help, as we said before, is a key strength.
And I suppose help looks like different things for different people. It might be a cup of tea, it might be a walk with a pal, it might be more formal help. It's just about what that person needs at that time. Okay. Eileen, you chatted to Eileen, didn't you?
I did.
She's a community matron. Tell me a bit more about Eileen and her role.
So Eileen is a really experienced nurse. She's a community matron, and she works with complex cases, trying to keep them out of hospital. That's her role. So therefore, very often they're older people with multiple etiology. And so she's worked a lot in the care homes. Now, as you can imagine, right at the beginning, working in the care homes, it was extremely difficult. Lots of people, multiple deaths in care homes, relatives not present. So again, that duality of role that she had to be the clinician as well as the support. She's also a team leader. So she has a full caseload and looking after the team. So that's really quite a difficult place to be, because she had pressure from the senior team to do the things that a team leader does, like sorting out the rotas, looking at the incident reports, doing, you know, development reviews, ensuring that people on probation get the proper probation process. But that creates that kind of pressure cooker where patients come first and foremost, but staff come first and foremost. So how do you manage that? She had been working 6 days a week for months, just to try and manage this workload. She said that the early challenges of PPE were really difficult because they all had slightly different PPE in the different teams. They were worried, frightened. Would it protect them? Because it was she said now that's eased because people do feel much more comfortable with the PPE and that it's safe now. They all have COVID swabs and they have antibody tests, and the antibody tests in the blood have shown that nobody in the team has been exposed, which is quite something. She also took, when I asked her about how she manages all that pressure cooker stuff, she talked about, again, walking the dog. It seems to be a theme. Talking to friends, support and help. Okay. But yeah, tough.
Really tough. And, just as you say, the impact of seeing so much death and dying psychologically is very challenging and very difficult to manage and take a lot of processing.
Yes.
What really struck me as well is that challenge of being both a team leader and a clinician. And what really struck me about it was Eileen, you can hear the fact that she's working 6 days a week, the fact it's so important to her. She's desperately trying to get it right. This is somebody who it is really important to do a good job for, and who puts her all in. But it sounds like she's in a position that despite her putting her all in, despite her doing everything she can, but despite her trying her best, actually she can't get it right because she just hasn't got enough hours in the day to be able to do everything to the way that she wants to do it and the best of, to the standard that she wants to do it. And that, I think, leaves her with a real challenge about how effective she feels she is. And one of the things that can happen when we're not being as effective as we want to be is we start looking to ourselves and, potentially blaming ourselves for actually being in a situation where she's almost functioning with her hands tied behind her back. She can't be all of those things to all of those people. And I think that can have a real impact. And when we talk about that, we often talk about kind of moral injury and moral distress, and I think I'll say a bit more about that in a minute. The other things that came through for me listening to Eileen were those early challenges of PPE and not feeling safe, and of course we can't work effectively when we feel as though our lives are in danger. We just can't be 100% present when we are under such significant threat. So I think it's extremely important that they now feel, and great that they now feel safe in it. And in terms of that, working 6 days a week for months, it just, that relentlessness of it, but it's just not manageable in the long term. So it's about finding ways to look after yourself in the short term and look after yourselves in the long term. But the pressure that she's under to enable her to do that is very challenging, isn't it?
Yes, very real pressure.
Yeah. So just to say something about moral injury and distress, because that's something that did come up when I was hearing Eileen's story and narrative, is that piece about where you've got really strong values and ethics and you're desperately trying to practice according to those, but because of the situation that you find yourself in, you're just not able to do it. So for example, you're in a situation where you're holding the hand of a dying person and you desperately want them to have their family there and they desperately want their family to be there, but because of the rules and you just can't do that. And how distressing that is psychologically, that you're unable to practice in the way that you want to practice. And that's what kind of moral injury is about, really. And in terms of what you can do in that very difficult situation, it's just about really managing the bits that you can manage, controlling the bits that you can control. So of course we're in control of our own behaviour and our responses, and we can stay in control of that. That's a really important part. Of course, talking to managers, and raising concerns, raising issues, making sure that we're practicing within our own ethical, professional boundaries. And I think there's something really important about talking to people about decisions that you're making, having shared responsibility for decision making, and just checking out with people kind of the position that you're coming from. So just to allow you to process it and make sure that it feels okay in terms of the decisions that you're making. And of course, keeping on top of own knowledge and skills and reflecting on experience, reflective practice.
Absolutely. I think that checking out about decision making is absolutely key, because you're left with it if you don't talk about it. And that's where you can start turning things in on yourself. And have those circuitous conversations with yourself that don't lead anywhere, really.
Yeah, it's just giving you a boundary for it, isn't it? It's a validity check.
Yes. Yeah.
Okay. So what did you hear in terms of what we can learn from Eileen?
I think one of the biggest things for me is having that supportive manager, having that safe space that you can go to and ask for help if you need it. I mean, imagine if you don't have that. That's really tough.
That would be really tough,
and the importance of getting fresh air, you know, and when work is finished, it's finished. So having some way to signal to yourself, I think, as we've said before, that work is finished, and getting out in that fresh air, taking some time for yourself, and making sure that days off are rest days. There is a pressure, and you could feel and hear the pressure in Eileen's story. But I suppose it's that taking that control back a little bit as best you can, and having open and honest discussions with your manager.
And looking after yourself in the shorter term so that you can keep working in the longer term, because it just isn't sustainable for people, I don't think.
No, it isn't.
Especially when you're doing such a significant job when you're in the job.
Absolutely significant job. Absolutely. So making sure you look after yourself. Rest days are rest days.
I really like what you were saying there as well about signalling the end of the day. That I think there's something about when we're working from home, and, you know, let's say people working in their kitchen and their dining room, and that there's something about at the end of the day, whether it's your 5 o'clock, 6 o'clock, 7 o'clock, whatever you decided, that at the end of that day, there's something that signifies the end of that day, whether it's about putting your laptop into a bag and putting the bag away in a different room, or putting your papers away. But there's something that says this kitchen has stopped being an office and has started being a kitchen again. So that helps with the psychological transition, the thing that the journey used to do that is no longer there, really. That it's putting something into place to allow that psychological journey from work to out of work.
I think you're right. And I think as well, if you are at work, you know, you are able to go into work, deciding at what point work stops. And it might be when you get in the car to drive home, it might be when you walk through the front door, but then practice, just stopping. And this is me now as an individual, not as a person that does a particular job.
It's important to have time for ourselves, isn't it? So I just wanted to say something at this point about post-traumatic stress disorder. A couple of reasons, really. One is we know from the research that this is something that healthcare practitioners experience and frontline workers. And indeed, we heard something from Andy about re-experiencing images of things that he's seen. And that is one of the symptoms of post-traumatic stress disorder. So we just really wanted to make sure you know the symptoms. I'm not going to go through them, but they're up there. And just, you know, keep an eye out for post-traumatic stress disorder, both for yourself and for your colleagues. And again, make sure that you're seeking the appropriate help if it's something that you're experiencing. So let's just recap.
So what have we learned?
Well, this situation is without doubt unprecedented. We've never been through anything like it, and we're learning as we go. And, you know, one of the key things that I think we saw with all 4 people is that they're constantly developing and changing the way they're working and what they're learning, which is incredible. So the situation is unprecedented, and it's absolutely okay not to be okay. Sometimes being a healthcare worker can make it harder to ask for help. And I think we just need to be aware of that and be prepared to do it. And again, prepared to ask how people are. Experiencing symptoms of stress doesn't mean that you're not up to the job. I think we would be much more surprised if people weren't experiencing symptoms of stress given the current situation that people find themselves in. Giving yourself, and if you're a manager, very importantly, giving your staff permission to step back, make sure that we're having breaks, we're taking rest days. And sometimes what we see in the NHS, because we're passionate about the jobs that people are passionate about, the jobs that they do, is that we see consistent overworking, really. And there's sometimes that competitive, oh, I did 70 hours last week, oh, well, I did 75. And that as a manager and as a culture, I think it's really important that we try to model a culture that looks after yourself. So I might almost be going, oh, I managed to get my 2 days off last week, you know, a competitive rest culture almost, in terms of, or a competitive looking after yourself culture somehow. And I think the other important thing is that some people who've never had to seek help before, and will probably never have to seek help again, might need to seek formal help, mental health support at the moment, and that's okay. So different support looks different for different people, but as long as we're asking for help when we need it and we're getting the type of support that we need at that moment in time, I think is the important message.
So some of the things that can help: setting small and achievable goals and celebrating them, however small they are. The importance of exercise and being outside, getting that daily dose of vitamin C. Building breaks into your diary and thinking time is absolutely crucial. Having a cup of tea with a colleague.
It's a great idea, wasn't it? Cup of tea meetings.
Brilliant. So that you're not focused on work, you're just focused on how are you. Yeah. So limiting the amount of news you consume seems to be a great thing that Andy suggested, and creating that space before work, if you can, to plan your day as best you can. Now, we know that days don't often go quite to plan, but it's lovely to be able to tick at least one thing off at the end of the day. Do try and set a finish time and stick to it for the day if you can. That seemed to be coming through from a lot of people. You know, signal to yourself, this is me done now. I'm done. Done for the day. And have a trigger action or a word to symbolize that that's it. It's me time now.
Really important. Okay, and then when it's over, what then? Well, I think we'll all breathe out a collective sigh of relief and have a huge sense of relief. But just to say, one of the things we know from research, specifically research around SARS and healthcare looking after that SARS outbreak, was that people do continue to feel distress and continue to have symptoms of PTSD, anxiety, psychological distress, etc. And they don't just arrive when it's all over. You know, we can take time to rightly process these things, and that, you know, for 18 months, 2 years afterwards, people can be vulnerable just as they're working through and processing everything that's happened. So just be aware of that for yourself, for your colleagues, and look out for how people are doing. So and really, I think that's the key message, isn't it? Is to look after yourself
and look after yourself.
Yeah, and then look after yourself some more.
Definitely.
Okay. So just to finish, we just really wanted to say a huge thank you to those people that were willing to talk to us. So a big thank you to Sally, a big thank you to Hilary, big thank you to Andy, and a big thank you to Eileen for being willing to share their stories with us. And we hope that you learned as much from them as we did.
Yeah.
So we hope you found that we hope you found it helpful, that you got some information from it that made sense for you. Just really give people the opportunity to make any comments, ask any questions. There's nothing in chat as yet, but if you want to ask us anything or say anything, then please do just put it in chat, and we will take it from there. Okay, so we'll just give you a minute, see if anybody has got any queries or anything. And if you haven't, you're very welcome to go, because that's the end of kind of the video session.
Thank you for taking the time to watch.
Yeah, absolutely. Okay, it's all flying in now. Great. Okay, so some people they're just saying that they found it really helpful. It was useful presentation. Great. Found it really useful. Found myself nodding and agreeing. Great.
Brilliant.
Okay. Very helpful. Been really helpful. Thank you. Heard a few things that rang true with me.
Yeah.
So it's good to develop an awareness of myself in this situation. And that's exactly what this was for.
Absolutely.
So absolutely delighted that people are recognising it and finding it helpful in these difficult times.
And knowing that you're not on your own.
Absolutely not. No. Lovely feedback there. Thank you very much. Really appreciate that.
Yeah, thankfully you can still come to work is a real theme, isn't it?
And see real life people.
Yeah.
What a great way of putting it. Yeah. Absolutely. We bring so much in that kind of collegiate way of working, learn so much from each other and support each other. And you know, when you get to go into work and you're there and you're present with your colleagues, you're giving so much to them as well.
Absolutely.
Fab. Just wondered how we can help inpatient colleagues with things like breaks during the day. They have less control over their time than when working from home. Absolutely. That's a really valid point. Thank you for that. And I think, you know, probably I'm thinking about this. My first port of call would be to ask them, you know, so to think together about, well, what is available, because you're absolutely right, there are constraints to it. What is available and what would people find most helpful out of what's available? And to, literally brainstorm together everything that is a possibility and then look at how people are supported into taking whichever possibility best suits them.
Yeah. It's that thing about proactively asking, isn't it?
Yeah, absolutely.
Making space to ask. And get people together. Yeah,
proactively asking and developing a collaborative way forward, as opposed to saying, I know what's best for you and I think you should be doing this. So to, you know, they're experts in what they do and what helps them. People are experts in themselves. And therefore, you know, if we ask them, they'll be able to come up with things that might help. That's a great question. Thank you. Really useful, especially within the health and wellbeing role that I'm currently doing. Great. Thank you. Really nice to know how others feel and the way that I've been feeling and how to cope with this. And I think that is really important because we only know how we feel, really. And, you know, if we only know how we feel, one of the things that we can do is then go, I feel like that because of me, because there's something not good enough about me or because I'm not doing a good enough job. And that's absolutely not the case. We feel the way that we feel because of the situation we find ourselves in. And the fact that everybody's feeling it is evidence of that and tells you that. So I think that's a really important take-home message.
So proactively share. Again, we're back to that, I
think. What's next for this research, if anything, or was it more aimed at building general awareness? Yeah, it is, to be fair. So the research that we talked about during the presentation isn't our research, you know, so we were referring to other people's research. So yeah, this was a one-off that we were asked to do as a webinar, just to build awareness of how people are feeling, really, and helping people understand psychologically what's happening. Okay, I'm looking to promote a staff wellbeing initiative in my workplace, but the terms wellbeing and resilience aren't well received in the team sometimes, as it can feel overused and not genuine. Completely agree with that. How would you suggest going forward and introducing a wellbeing initiative in a slightly reluctant team? Any tips gratefully received. What a great question. I can completely see, I think wellbeing is overused sometimes. I don't think we always have a shared language and understanding when we use it. And certainly in the NHS, I've also heard some resistance to the term resilience. And I think that's a perception that people are just being asked to be more resilient without anything changing, which then puts the blame on the people, not on the systems or the situation they find themselves in, which is completely wrong. Is that?
Yeah, I completely agree. I completely agree. And I think tips, let's think. I would probably get it out on the table and say, you know, some people really don't like the words wellbeing and resilience. Can you tell me how you feel about those? What do they mean to you? Because then once you get it out on the table, people can you can sift through it. They might find a better word that connects to what they really want and need. So they might find a better word. So I think I would start with that, getting it out on the table that some people don't actually like those words. What do they mean to you?
Ask them.
Ask them.
It's that collaborative piece of work again, isn't it?
Yeah,
And it might be best ways that we support you, things that we can do to help.
Yeah.
It doesn't matter, does it? As long as they're engaged in it. And that's about asking them the answer so that they're engaged in it.
Yeah.
Fab.
Co-creation.
I agree. I think the term resilience is used as a suggested treatment.
Yes.
Instead of how to support staff every day and
Yes.
help them through reflection and support to cope with the everyday. Thank you.
Completely agree. Completely agree. And it's such a shame, really. For me, that's a real shame.
Yeah, it is, because it's lost the power of what
it is. Yeah, yeah, but yeah, I agree.
Really useful in helping to normalise abnormal circumstances. Great. Thank you.
I think that's an absolute key. An absolute key. We all feel it.
Okay, I think that might be it. The chat is slowing down as it's coming in, so can we just take the opportunity to say thank you so much for coming and viewing it, taking the time out on a Monday morning in what we know are people's very busy lives. And of course, this is going on the Recovery College website. So talk to your colleagues about it. And if you think they'll find it helpful, let them know about it too.
Yeah.
Okay.
So, take care.
Thank you very much.
And look after yourself.
Absolutely.
Bye.